I want to start this video with an apology. Not a small one, not a polite one, a real apology on behalf of the medical community. Because for decades we told you that managing your blood sugar was about willpower, about discipline, about eating less and moving more, and we left out something that was sitting in most of your kitchen cabinets the entire time. Something so ordinary, so cheap, so completely underestimated that when I first reviewed the research behind it, I actually felt a little embarrassed. We spent years prescribing medications with side effects that filled entire pamphlets. And the answer, at least part of it, was something your grandmother probably used to clean her countertops. I am talking about apple cider vinegar. And before you close this video thinking you already know this story, I need you to stay with me, because what most people get completely wrong about apple cider vinegar is not whether it works. The research is quite clear on that. What most people get wrong is why it works, how to use it correctly when it becomes dangerous, and what specific combinations amplify its effects to a point that is genuinely remarkable. Because when you understand the actual biological mechanism, when you understand what is happening inside your cells at the moment you consume it, you will never look at this bottle the same way again. And the reason this apology feels necessary is that we live in a medical system that is far better at treating symptoms than addressing root causes, far better at prescribing pills than explaining the underlying biology, and far more comfortable with expensive interventions than with humble, inexpensive ones that cannot be patented. That is not a conspiracy. It is simply how the incentives are structured. But it means that people like you, people who are genuinely trying to take control of their health, often end up with incomplete information. That ends today. Let me ask you something personal before we go any further. On a scale from 1 to 10, how confident are you right now in your ability to control your blood sugar through food and daily habits? Leave that number in the comments below. I read every single one, and your answer tells me a great deal about where most people are starting from and what they need most. If you are sitting somewhere between a 3 and a 6, I want you to know that is exactly where the majority of my patients are when we first start working together. And it is not a permanent state. And if you are not yet subscribed to this channel, I want to ask you to do that now, not because of some algorithm reward, but because the information I share here is the kind of thing most doctors simply do not have time to explain during a 15-minute appointment. I have been in clinical medicine long enough to know how those conversations go. There is a blood pressure reading to review, a medication to refill, maybe a referral to write, and suddenly the appointment is over and you leave with more questions than answers. You deserve a source you can trust, someone who stays honest with you even when the truth is inconvenient. So hit that subscribe button and let us get into what your body actually needs you to know. The story of apple cider vinegar and blood sugar begins with a molecule called acetic acid. That is the primary active compound in vinegar, and it sounds intimidating. But let me paint you a picture that will make it instantly clear. Imagine your muscle cells as a locked room, and glucose, which is blood sugar, as people trying to get inside. The door to that room is opened by a key called insulin. When your insulin is working properly, the key fits perfectly, the door opens, glucose walks in, and your blood sugar stays balanced. Your cells get the energy they need, your pancreas does not have to work overtime, and everything downstream, your energy levels, your mood, your inflammation markers, your long-term cardiovascular risk, stays within a healthy range. But in most people with type 2 diabetes or prediabetes, the lock has become stiff. The key is there, it is being produced, but it no longer fits as smoothly as it used to. The pancreas actually compensates by making more keys, more insulin, which works for a while, but eventually even more insulin cannot fully overcome the resistance, and glucose begins to accumulate in the bloodstream instead of entering the cells where it belongs. That is what we call insulin resistance, and it is the central mechanism driving the epidemic of type 2 diabetes that affects over 37 million Americans and hundreds of millions of people worldwide. I need you to listen to this message very carefully, because what I'm about to reveal could protect your health and perhaps even save your life. For a long time, I didn't realize the danger that excess blood sugar represented. I discovered that high glucose levels can increase the risk of heart attack, stroke, vision loss, and even amputations. The scariest thing is that type 2 diabetes often acts silently. Many people believe everything is fine when, in fact, their bodies are already suffering serious damage. And if your blood sugar is high right now, you may be at much greater risk than you imagine. But then I discovered a completely natural method that helped me understand how to balance my blood sugar levels and regain my quality of life. Thousands of people are also discovering this simple method and learning how to naturally reduce excess sugar and avoid the dangers of type 2 diabetes. And there's something important you need to know. All this information is compiled in a special video that we don't know how long will be available. If you want to discover what I discovered and learn a natural way to help control your blood sugar levels, click the link in the first pinned comment now and watch the video before it's taken down. Now here is where acetic acid becomes extraordinary. When you consume apple cider vinegar, the acetic acid travels into your digestive system and does something remarkable at the cellular level. It activates an enzyme called AMPK, which stands for adenosine monophosphate activated protein kinase. But you do not need to remember that. What you need to understand is that AMPK functions like a master energy switch inside your cells, one that tells your muscles to absorb glucose even when the insulin key is not working perfectly. It essentially bypasses part of the broken mechanism. It opens a side door that was always there but was never being used. This is not a metaphor I invented. This is a documented biological pathway, and it is the same pathway activated by the most commonly prescribed diabetes medication in the world, metformin. When researchers first started studying metformin's mechanism, they discovered it works largely through AMPK activation. Apple cider vinegar activates the same pathway through a different route. That does not make them equivalent, and I want to be precise about that. But it does help explain why the blood sugar lowering effect of vinegar is real, reproducible, and mechanistically coherent rather than simply anecdotal. A landmark study published in the journal Diabetes Care in 2004, conducted by researchers at Arizona State University with 29 participants divided into 3 groups, including healthy adults, people with insulin resistance, and people with type 2 diabetes, found that consuming 2 tablespoons of apple cider vinegar before a high-carbohydrate meal reduced post-meal blood sugar by up to 34% in the group with insulin resistance. 34%. Think about that number for a moment. That is not a marginal effect. That is not statistical noise. That is a clinically meaningful reduction in the blood sugar spike that repeated meal after meal, year after year, is what drives the progression of type 2 diabetes, damages blood vessels, inflames nerves, contributes to kidney decline, and quietly erodes your quality of life in ways that do not become visible until the damage is already extensive. And this was achieved with 2 tablespoons of a liquid that costs less than $4 at any grocery store. A follow-up study published in the European Journal of Clinical Nutrition in 2005 confirmed that vinegar consumed with a meal reduced the glycemic index of white bread by as much as 31%. The glycemic index, for those who are not familiar, is essentially a measure of how fast a food raises your blood sugar on a scale from 0 to 100, where pure glucose is rated at 100. White bread on its own has a glycemic index of approximately 71, which is nearly as high as pure table sugar and higher than many candy bars that people intuitively understand are bad for them. With vinegar, that number dropped significantly, transforming a high glycemic food into something that behaved more like a moderate glycemic one. The researchers concluded that the acetic acid was slowing the rate at which the stomach empties its contents into the small intestine, a process called gastric emptying, which means glucose enters the bloodstream more slowly, more gently, and the pancreas is not forced to dump a massive wave of insulin in response. It is not magic, it is mechanics. And once you understand the mechanics, you can use them intentionally. That distinction matters enormously because understanding the why gives you the ability to apply this information intelligently rather than just following a trend. Now let me walk you through the specific methods of using apple cider vinegar that the research actually supports, because there is a right way and a wrong way, and most of the videos you will find online are missing critical details that make all the difference between something that genuinely helps you and something that becomes an expensive habit with no measurable benefit. The first method is the pre-meal dilution protocol, and this is the one most directly supported by the clinical data I just described. You take 1 to 2 tablespoons of raw, unfiltered apple cider vinegar, the kind that has what is called the mother, which is the cloudy sediment you see floating at the bottom of the bottle, and you dilute it in a full glass of water, at least 8 ounces, and you drink it 15 to 30 minutes before your largest carbohydrate-containing meal of the day. The timing matters because you want the acetic acid to be present in your digestive system when the meal begins to break down, not arriving 20 minutes after the glucose wave has already started. The dilution matters because undiluted vinegar is corrosive to soft tissue, and I will explain that in detail shortly. A patient of mine, I will call her Sandra, was 58 years old, a retired teacher, and had been struggling with fasting blood sugar readings consistently between 118 and 132 for almost 3 years. Her physician had already started the conversation about medication, and Sandra was terrified. Not of the medication itself, but of what it meant, the label, the permanence of it, the feeling that something had crossed a threshold. She began using this exact protocol before dinner every evening, just the diluted vinegar, 15 minutes before eating. Within 6 weeks, her fasting numbers had dropped to between 98 and 107. Her physician was, in her words, genuinely surprised. She had not changed anything else. Same diet, same activity level, same sleep schedule. The only variable was the pre-meal vinegar ritual. I am not telling you that apple cider vinegar replaces medication, but I am telling you that this mechanism is real. The research backs it up, and Sandra is not an isolated case. I see versions of her story regularly in clinical practice. The second method involves combining apple cider vinegar with soluble fiber, and this is where the effect becomes compounded in a way that most people never take advantage of. Soluble fiber, found in foods like oats, chia seeds, flaxseed, psyllium husk, and legumes, also slows gastric emptying and blunts the glucose response to meals by forming a gel-like substance in the gut that physically delays the absorption of carbohydrates. When you pair soluble fiber with apple cider vinegar in the same eating window, you are essentially stacking 2 mechanisms that work through slightly different but complementary pathways. The acetic acid activates AMPK in the muscle cells and slows stomach emptying from one direction, while the fiber creates a physical barrier to absorption from another direction. A study published in the Journal of the American College of Nutrition found that combining vinegar with a meal containing soluble fiber reduced the 2-hour post-meal glucose response by nearly 50% compared to the meal alone. 50%. You do not need exotic ingredients to make this happen. A glass of diluted apple cider vinegar and a bowl of oatmeal with chia seeds for breakfast is not a sacrifice. It is a strategy, one that is backed by a clear mechanism and reproducible data. If you are someone who eats oatmeal in the morning anyway, adding the vinegar protocol before that meal is perhaps the lowest effort, highest return modification you can make. The third method is what I call the bedtime blood sugar protocol, and it is specifically relevant for people whose fasting glucose in the morning, meaning their blood sugar when they wake up before eating anything, tends to run high even when they have been careful about dinner the night before. This phenomenon is called the dawn phenomenon, and it happens because your liver releases stored glucose during the early morning hours, typically between 3 a.m. and 8 a.m., as part of its normal hormonal response to the cortisol and growth hormone surges that naturally occur during sleep. For people with insulin resistance, this liver glucose release can push fasting numbers up significantly and unpredictably, which is deeply frustrating for people who are doing everything right during the day only to wake up to a high reading. A small but compelling study published in Diabetes Care in 2007, involving 11 participants with type 2 diabetes, found that taking 2 tablespoons of apple cider vinegar at bedtime, diluted in a few ounces of water, reduced fasting glucose the next morning by 4 to 6% on average. That might sound modest, but for someone whose fasting number is consistently sitting at 130 or 140, a 4 to 6% reduction translates to real, measurable movement in the right direction. More importantly, the reduction was consistent across the study period, meaning it was not a one-time effect but a repeatable outcome. Over weeks and months, that kind of consistency compounds into meaningful improvement in overall glycemic control, which shows up in your HbA1c, which is the 3-month average blood sugar measurement your doctor uses to assess long-term management. The fourth method is using apple cider vinegar as a salad dressing base. And this is perhaps the most elegant approach because it integrates the vinegar into a meal that already tends to be low glycemic. When you eat a salad before a carbohydrate-containing meal, you are already using the fiber and water content of the vegetables to slow digestion. Adding an apple cider vinegar-based dressing layers the acetic acid effect on top. You are building a pre-meal buffer that works on 2 levels at once without requiring any extra steps. One study from Sweden found that subjects who consumed a vinegar-based salad dressing before a high-starch meal had significantly lower post-meal blood sugar compared to those who used a non-vinegar dressing, even when all other variables were identical. For people who find it difficult to drink vinegar and water, this is a practical and genuinely effective alternative. 2 tablespoons of apple cider vinegar, 1 tablespoon of olive oil, a pinch of salt, a squeeze of lemon juice, and whatever herbs you enjoy is all it takes. Now, I want to be honest with you about something, and this is the part of the video that I consider most important, because I have seen people harm themselves by misusing this information, and I refuse to let that happen to someone who came here genuinely trying to improve their health. The first and most urgent warning is this: never drink apple cider vinegar undiluted. I know this sounds obvious, but the internet is full of challenges and wellness trends encouraging people to take it as a straight shot, sometimes multiple times a day, and the damage this causes is not theoretical or exaggerated. It is documented in published medical case reports. The acidity of undiluted apple cider vinegar has a pH of approximately 2 to 3, which is comparable in its erosive potential to stomach acid, and drinking it straight means bathing your throat, esophagus, and stomach lining in that acidity repeatedly over time. A case report published in the Journal of the American Dietetic Association described a woman who had consumed 1 tablespoon of undiluted apple cider vinegar daily for 6 years and developed severely damaged tooth enamel and chronic throat inflammation. Separate case reports describe chemical burns to the esophagus in people who drank large amounts straight. The damage in these cases required medical intervention, and in some instances was not fully reversible. This is not a minor inconvenience. This is a real risk that is entirely preventable by simply adding water. Always dilute it. There is no health benefit to drinking it undiluted that outweighs the damage it causes. The second warning involves the interaction between apple cider vinegar and blood sugar lowering medications, and this is something I cannot stress enough for anyone currently taking insulin, metformin, glipizide, glympyride, or any other glucose-lowering agent. Apple cider vinegar genuinely lowers blood sugar. That is the entire scientific basis of this video. But when you layer its blood sugar-lowering effect on top of medication that is already doing the same, you can drop your glucose too far into a zone called hypoglycemia, which can cause dizziness, confusion, sweating, heart palpitations, and in severe cases, loss of consciousness. Hypoglycemia is not a minor inconvenience. It is a medical event that can be dangerous, particularly if you are driving or sleeping. I am not saying apple cider vinegar and diabetes medication cannot coexist. I am saying their combination must be supervised. If you are on any blood sugar medication and want to add vinegar protocols to your routine, tell your doctor, monitor your glucose more frequently during the adjustment period, and adjust your medication only under guidance. The third warning involves a condition called gastroparesis, which affects a meaningful percentage of people with long-standing type 2 diabetes, sometimes without their knowledge. Gastroparesis is a condition in which the stomach's ability to empty itself is already significantly slowed due to nerve damage from chronic elevated blood sugar. Apple cider vinegar works in part by further slowing gastric emptying. If you already have gastroparesis, adding vinegar to your diet can worsen nausea, increase bloating, and cause unpredictable glucose swings from inconsistent absorption. The warning signs include feeling full very quickly when eating, persistent nausea after meals, and bloating that lasts for hours after eating. If any of those symptoms sound familiar, please speak with your doctor before starting any vinegar protocol. The fourth warning is about what I call the permission trap. Apple cider vinegar is a real, scientifically supported, clinically meaningful tool, but it is a tool within a larger system, not a substitute for that system. I have seen patients who began the vinegar routine and then quietly started eating more refined carbohydrates because they felt protected, as though the vinegar had earned them a buffer. A handful of crackers, a little more bread, an extra dessert because they had done their vinegar before dinner. That is not how this works. The vinegar reduces the spike that follows a carbohydrate-containing meal. It does not eliminate it. If you consistently eat in ways that overwhelm your glucose regulatory system, no amount of vinegar will compensate for that. The foundation still matters. This remedy is most powerful when it amplifies an already thoughtful approach to eating, not when it patches over a consistently poor one. I want to take a moment and acknowledge something I think about often. The fact that you are here, that you spent time looking for this information, that you are trying to understand your body at a deeper level rather than just waiting for your next prescription, that is not nothing. Most people in your situation have been told, often implicitly, that their job is to take what the doctor prescribes and come back in 3 months. But there is a version of medicine where patients who understand the mechanisms, who ask better questions, and make more informed decisions consistently do better. Not because they replaced medical care, but because they became active participants in it rather than passive recipients of it. That is the version I am trying to support with every video I make here. Let me now bring everything together with specific action steps, because information that does not translate into behavior change is just entertainment. The first action you can take today is to buy a bottle of raw, unfiltered apple cider vinegar. Not the clear, filtered kind. The kind with the mother, the cloudy sediment at the bottom, that contains the enzymes, bacteria, and proteins that are largely absent in the refined version. The Bragg brand is the most widely studied, but any raw, unfiltered variety will contain the relevant compounds. It should cost between $3 and $6 at almost any grocery store or pharmacy. The second action is to start the pre-meal protocol tonight if you are not on any blood sugar medication, or to call your doctor's office this week if you are, to ask whether adding this protocol is appropriate for your current treatment plan. For those starting without medication, begin with 1 teaspoon in a full glass of water 15 minutes before your largest carbohydrate-containing meal. Give your body 1 full week before increasing to 1 tablespoon, and another week before reaching 2 tablespoons if you tolerate it well. Starting slowly prevents the digestive discomfort that causes most people to quit before they see any results. The third action is to track your response if you have a glucose meter at home. Take your blood sugar 15 minutes before consuming the vinegar mixture, and again 2 hours after the meal. Do this for 2 weeks without the vinegar first to establish your personal baseline, then add the protocol and compare the 2-hour readings over the following 2 weeks. Nothing will convince you of this more effectively than your own data. A glucose meter and test strips are inexpensive and available without a prescription, and the self-knowledge they provide is genuinely invaluable. The fourth action is to pair the vinegar protocol with 1 additional blood sugar supporting habit. The most powerful pairing, based on the research, is a 10-minute walk after your largest meal. A study published in Sports Medicine in 2022, analyzing data from nearly 5,000 participants, found that a short walk taken within 30 minutes after eating reduced post-meal blood sugar by up to 30% compared to sitting. When you combine the vinegar protocol before the meal with a brief walk after it, you are addressing the glucose spike from both ends simultaneously. The vinegar slows the rate at which glucose enters the bloodstream. The walk accelerates the rate at which the muscles clear it. These 2 habits together require no equipment, no gym membership, no prescription, and no significant time investment. They require only consistency. The fifth action is to rinse your mouth with plain water immediately after consuming the diluted vinegar, and to wait at least 30 minutes before brushing your teeth. Even diluted vinegar temporarily softens tooth enamel due to its acidity, and brushing immediately after can accelerate enamel erosion. This is a simple protective step that most guides leave out, and it matters for your dental health over the long term. Before I close, I have a specific request for the comments section. Tell me one thing you are going to do differently after watching this video. Not a vague intention like eating better, something specific and executable. Are you going to buy a bottle of raw apple cider vinegar on your next grocery run? Are you going to try the pre-meal protocol tonight? Are you going to ask your doctor at your next appointment whether the bedtime protocol is appropriate for you? Write it down. There is genuine research showing that people who articulate a specific behavioral intention in writing are significantly more likely to follow through than those who simply feel motivated. I want you to follow through because you clearly care about your health, and that clarity deserves to become action. If there is someone in your life who has been told their blood sugar is trending high, or who has already been diagnosed with prediabetes or type 2 diabetes, please share this video with them. Send it to that parent who is struggling. Share it with the friend who mentioned last month that their doctor is worried about their numbers. That is one of the most meaningful things you can do with the next 30 seconds of your day, and it costs you nothing. My name is Dr. James Carter, and I have spent more than 20 years in clinical medicine, the last 12 of them focused specifically on metabolic health, insulin resistance, and the nutritional strategies that either accelerate or reverse the damage that chronically elevated blood sugar causes over time. I am grateful you spent this time with me today. I do not take it for granted. Everything I share on this channel is grounded in published research, real clinical experience, and a genuine commitment to giving you the information you need to make meaningful decisions about your own health. Please remember that this video is for educational purposes only and is not a substitute for personalized medical advice from a physician who knows your full health history, your current medications, and your individual circumstances. If you are managing diabetes, prediabetes, or any other metabolic condition, please work with a qualified healthcare provider before making changes to your treatment plan. Take good care of yourself. You are worth the effort.